afternoon. My name's Laura. I'm going to be doing your assessment today. Can you tell me your name and date of birth?
My name is Lisa Strohmeyer. My date of birth is August 19th, 1992.
Fantastic. And can you tell me what year it is?
It is 2023.
And do you know where you are?
I'm at the clinic.
And what are you here for today?
I'm just here for a physical.
Fantastic. Thank you for coming in. Now, do you have any concerns?
No.
Okay. And do you have any health conditions that I should be aware of?
No.
Do you have any allergies?
Yes, I have seasonal allergies and I take Allegra as needed.
Fantastic. Do you know how much Allegra you take?
60 milligrams.
And how often do you take it?
I take it about every day, once a day, and it usually is in the spring for about 2 weeks or so.
Fantastic. Do you take any other medications?
No.
Okay. Well, let's get started with your exam then. Can you tell me how tall you are?
I am 5'3".
And can I have you stand on the scale for me?
Sure.
Okay. Fantastic. 152. Now I'm just going to grab your vital signs.
Okay.
Perfect. If I can take your arm for your blood pressure. Stand this way. And if I can actually see a finger on your other hand. Wonderful. 99%. Now, while we wait for your blood pressure, is it okay if I use a BMI calculator?
Of course.
Fantastic. And you said you were 5'3".
Correct.
152. Awesome. Your BMI is 26. And your blood pressure is 120/82. Now if I can snag your arm there for me. Fantastic. The pulse is 82 and your respirations are 14. Now, are you having any pain today?
No.
Have you had any pain recently?
No.
Fantastic. I'm going to start the exam by just looking at your hair, your skin, and your nails. Okay, so I'm going to walk around a little bit just to take a look at anything. Do you have any areas of concern?
No.
Fantastic. Okay. Now, have you noticed any loss of hair recently?
No.
Have you noticed any unusual hair growth?
No.
Awesome. And your skin looks good. Can I just take a look at your nails? Perfect. All right. Thank you. We'll start the next section. It's going to focus mainly on your head and your ears and your eyes, okay?
Okay.
Okay. All right, Ms. Strohmeyer, we are going to start by massaging your scalp here a little bit, okay? I'm checking for masses. Any pain anywhere?
Nope.
Wonderful. Okay. And the next part I'm going to do is I'm going to palpate on your sinuses, okay? Any pain or pressure?
No.
Beautiful. Now, can I have you clench your jaw for me? And I'm going to push on your jaw. Don't let me open it. Excellent. Okay. Now I'm going to check your nose. So I'm going to have you tip your head back for me. Wonderful. Wonderful. Now with your head tipped back, I'm going to check to see if you have fluid in your sinuses. So I'm going to shine the light up your nose, okay? See if I can see into them. Good. And can I have you tip your head down and open your mouth? Excellent. Now, if I can have you close your eyes, when you feel a touch, tell me if it's sharp or dull. Okay? Sharp. Sharp. Dull. 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 Sharp. Sharp. Wonderful. If you can open your eyes. Now, can you raise your eyebrows up and down for me? And can you smile? And frown? And close your eyes and open them? Good. And can you stick out your tongue? Excellent. Now, I'm going to just check this to make sure that it fits in your ear okay, and then I'm going to start your ear exam. Okay, so can I have you look to the left? Excellent. And excellent. Okay. Now, if you look to the left again, I'm going to pull on your ear. And you look to the right. All right. Now, have you noticed any changes to your hearing recently?
No.
Good. Now, same deal. I'm sorry if I pull on your earrings too much, okay? I'm going to try not to. Excellent. Excellent. Okay. Now, if you can close off one ear for me, and you're going to repeat what I say, okay? 94.
94.
And can you close the other ear for me?
37.
Fantastic. All right, so the next part of the exam entails looking at your eyes, okay? So I'm going to start the exam from here, and then I'm going to have you get on the table, okay?
Okay.
When you look straight ahead, I'm going to pull down on your eyes there. Can I have you look up? Beautiful. Okay, I'm going to have you get on the table now. Okay. Now the next part of this, I'm going to have you look straight ahead without moving your head. I want you to follow my finger with just your eyes, okay? All right. Excellent. Okay. Now I'm going to have you follow my fingers. Tell me when you can't see them anymore. Okay, look straight at me for this whole thing. Ready?
Stop.
Wonderful. So we're checking your peripheral vision and it's excellent. All right, for this next part, I'm going to shine a bright light in your eyes. I want you to just look straight ahead, okay? Excellent. I want to look at the inside of your eye, okay?
Okay.
Now, this unfortunately can make people a little uncomfortable because I have to be kind of close, okay? Okay. Excellent. And on the other side here. Excellent. As part of your exam, I'm going to be checking your lymph nodes, okay? After that, I'm going to do a couple things with your neck, and then we're going to check your mouth and your throat, okay? So I'm going to have you tip your head down. We'll start there. Now, let me know if you experience any pain with any of this. Anything?
Nope.
Wonderful. Okay. Fantastic. Now, I'm going to put my finger on your throat. I'm checking to make sure that your trachea or your windpipe is nice and center, okay? You're going to feel me kind of push side to side here. Any pain?
Nope.
Beautiful. Now, the next part is I'm going to check your thyroid, okay? So when I tell you to, I'm going to have you swallow, okay? This does require me pushing on your throat again. All right? Now, I'm going to have you swallow. Excellent. And swallow. Excellent. Any discomfort with any of that?
No.
Fantastic. Okay. Now, I'm going to start with just looking in your mouth, and then what I'm going to do is put a tongue depressor down, and then check your gag reflex at the same time. Okay, so I'm going to say ah.
Ah.
And for me again.
Ah.
Excellent. Okay, can you stick your tongue out for me? And side to side. And then put your tongue up. Wonderful. Now for this next part, I'm going to have you say ah one more time. And gag reflex for me. Beautiful. Fantastic. Thank you. Okay, Mrs. Strohmeyer. So the next part of your exam involves looking at your chest and abdomen. So I'm going to ask if you can take your t-shirt off for me, and I'm going to get the supplies for this. Here, I'll set your shirt down on the chair.
Thank you.
So what we're going to start with is I'm just going to kind of walk around and look at your chest, look at how it kind of rises and falls, okay? Excellent. Now I'm just going to put my hands here. I'm going to breathe normally. And I'm going to have you turn slightly. I'm going to do the same thing to your back. Excellent. And what I'm going to have you do is just breathe normal, okay? Okay. Now the next part of the exam is going to feel a little different, okay? I'm going to be checking what we call as a diaphragmatic excursion. So how much your diaphragm flattens when you take a deep breath in, okay? How it's going to work is I'm going to have you breathe normally and then take a big deep breath in and hold it. And you're going to feel me tap on your back. And then I'm going to make a slight mark on your back, okay? Okay. And I'm going to have you breathe normal for a little bit. Then I'm going to have you blow out all the air you can until you feel like you don't have any left. I'm going to have you hold your breath there, and I'm just going to tap up and make another mark. And then you can breathe normal while I measure. You have to do this twice though, okay? I have to measure each side. Alright, so I'm going to have you twist again for me. Okay. And I'm going to just pull your hair off to the side here. Okay. I'm going to have you breathe normal for me. And deep breath in. Good. And breathe. Okay, take a couple deep breaths. I'm just going to darken that mark slightly. Wonderful. Okay. And when you're ready, I'm going to have you blow all your air out and hold your breath. And breathe. Okay. And I'm just going to do some measuring while you breathe nice and normal here for me. Alright, right at 6.5 centimeters. Excellent. And I'm going to do it again on the right side, okay? Okay. Alright. When you're ready, and breathe. Okay, and when you're ready, I'm going to blow your air out. And breathe. And I'm just going to do some more measuring. Okay, good. Another 6.5 centimeters. Excellent. Now the last part is I'm going to place my hands on your back and I'm going to have you repeat the word 99, okay? Okay. Ready?
99.
And again.
99.
And again.
99.
Alright, I'm going to have you turn and then do it to the front. Okay.
99. 99.
Excellent. Thank you. What we're going to start with next is I'm going to start checking your lungs. So I'm going to tap on your lungs front and back, and then I'm going to take a listen, okay?
Okay.
Alright. Yeah, I'm not too concerned that I can't hear much over your chest, which can be normal. Okay, I'm going to have you turn slightly. Okay. I'm going to tap on your back. I am going to have you pull your hair off for me. Excellent. Now I'm going to take a listen to all of those same areas. I apologize if this is a little cold. I'm going to try and warm it up as best I can. And deep breaths in. Okay, and same in the back. Excellent, your lungs are nice and clear. Now, if I can have you shrug your shoulders up and down for me. Okay, and against resistance. Wonderful. All right, I'm gonna have you lay flat for me on the table, okay? What I'm gonna do is I'm going to check your heart and your chest, okay? I'm looking for any divots in your sternum or anything like that, and I'm just gonna get your pulse. Beautiful, nice and regular, strong. Excellent. Now I'm going to have you sit back up. What I'm going to do is I'm going to listen to your carotids, okay? And then I'm going to take your carotid pulses.
Okay.
Okay. Wonderful. Wonderful. Keep that on for a minute. Excellent. Excellent. All right, I'm going to finish by listening to your heart, okay?
Okay.
Now I am going to use both sides of my stethoscope, so it will take me a little bit longer. Okay. Just breathe normal. Nope, you're good. There, again. Excellent. I don't hear any murmurs. Your heart sounds nice and normal. Good. At this point in your physical examination, we would normally do a breast exam. Are you comfortable with doing that today?
I would like to decline today.
Okay. That's absolutely fine. If it's okay with you, I would like to go over what we normally would do in case you change your mind in the future.
Sure.
So normally with a breast exam, we would have you take your sports bra off, and we would just look at the skin of the breast and just to make sure there aren't any lumps, discolorations, or dimpling that's obvious just from you sitting. We would also have you kind of lean forward just to see how your breasts move and to make sure that there isn't any discolorations, lumps, or dimpling on the underside of your breast. After that, we would have you lay on the examination table. I prefer to do a circular method, although I know other providers choose one of the other two methods to do the exam. And what I would do is just use the pads of my fingers to go outward from the areola all the way into the talus fence, just looking for any lumps or masses or lesions that I can feel underneath the skin. I would do that on each side. Once I'm done with that, I would actually kind of pinch your nipple gently, just to make sure there aren't any masses in the nipple and to check for any discharge. Sometimes discharge can be normal, especially shortly after pregnancy, although if you have discharge outside of a normal period of time after that, we would look to see if there was any color or odor to that discharge to make sure that you don't have an infection. Okay? Final portion of the breast exam includes checking the lymph nodes in your armpit and your upper arm. And what we would do is we would have you sit upright from the table and raise your arm above your head, and I would just go down palpating just to see if the lymph nodes are enlarged or tender. After that, we would also check the inner arm because those lymph nodes are all connected in that same portion of the system. And again, we would do this bilaterally just to make sure everything is the same. Any questions on that?
No.
Okay. Now, please make sure that you're doing self-breast examinations every month at home, okay?
Absolutely.
We're going to do the assessment of your abdomen now, okay? So I'm going to have you lie back on the table. And I'm just going to start with just watching your abdomen. Just taking a look to see how it kind of rises and falls. Excellent. Okay, and then the next step is I'm going to take a listen, okay?
Okay.
A little cold. Excellent. Now I'm going to take a listen to some of the major arteries in your abdomen. Okay, wonderful. All right. Now I'm just going to do some tapping like we did before, okay? And then the next part is I'm going to do some more tapping. I want to measure your liver. Okay, so I'm going to make a couple more marks.
Okay.
Excellent. Sorry about the pen. It's a gel pen though, so it should wash off without a problem. Alright, and put the top down. Wonderful. Okay. Just a quick measurement here. Alright, so your liver is 9 centimeters. Beautiful, nice within normal range, okay?
Good.
Now the next part is I'm going to just press lightly on you. Tell me if you have any discomfort. Okay, and then I'm going to press deeply. Any pain?
Nope.
Any tenderness?
Nope.
Wonderful. Next is I'm just going to check your lymph nodes. I don't feel anything, so no tenderness anywhere, right?
Nope.
Alright, I'm going to have you sit back up then, okay?
Okay.
Excellent. Now I'm just going to kind of start working on your pulses from pretty much your wrists all the way down to your toes, okay?
Okay.
So just nice and relaxed for me. Excellent. These are your brachial pulses. And I checked your femoral pulses already, so we're good there. So I'm going to have you just relax your legs for me. Wonderful. Now I do have to take your socks off. I hope that's okay.
Okay.
We can put them on right at the end of this. I would like to check the pulses in your feet though. Good. Nice and strong. Fantastic. Alright, I can have you put your socks back on and your t-shirt. We're going to start checking your range of motion through each of your joints, okay? So we're going to actually start with your head and your neck. So if I can have you just look up and down, and then tip your head back for me. Fantastic. Side to side. And then if you can just do a circle. Wonderful. Okay, now I'm going to have you, can you turn your head like this? Okay. Now I'm going to have you turn your head into my hand. Now don't let me push your head back. Wonderful. We're going to do it on the other side. Turn into my hand and don't let me push you back. Okay. And then I'm going to have you push your forehead into my hand. Excellent. Wonderful. You have excellent strength throughout your head and your neck. We're going to start. I'm just going to examine your shoulder a little bit and then I'm going to have you do some range of motion. Okay?
Okay.
Now, just try to hold still for me. Excellent. Let me do the other side. Any pain when I push on you?
Nope.
Wonderful. Okay, so I'm going to have you stand up nice and tall for me. And I'm going to have you bring your arms straight up. Any trouble doing that?
Nope.
Excellent. And bring them back down. Okay, I'm going to have you raise your arms a little. And bring them up against me. Good. And then excellent. Okay. Next test we're going to do is I'm going to have you one arm at a time. Bring it up over your head. Okay. And then bring it down across your body. Excellent. Watch your hand on the table. Wonderful. And the other arm. Excellent. Now I'm going to have you do the same thing. Bring your arm out against my hand. Good. And bring your arm in. Excellent. And same on the other side. And excellent. Okay, now for the next test, I'm going to have you go 90 degrees and bring your arm in one at a time and out as far as you can go. And the other side. Any trouble?
Nope.
Okay, I'm going to have you push against me. And good. And again. And push. Excellent. Have you bring your arms up and behind your head and just bring your shoulder blades together. Good. Now don't let me try and bring your arms in. And pull back. Wonderful. For this last one, I'm going to have you bring your arm back one at a time. And I'm going to have you make a thumb up and bring it up as far as you can go.
Okay.
Wonderful. And the other arm, nice and slow. Excellent. Any discomfort with any of those?
Nope.
Fantastic. Okay, Mr. Meyer, so for this next part, I'm going to have you face me. I'm going to have you bend your arms for me. Relax them just a little. All right, and pull up against me. Wonderful. I'm going to have you push against my hands. Excellent. Now I'm going to have you reach across and grab your opposite shoulder, and I'm going to bring your arm up. Any discomfort?
Nope.
And we're going to do the other side. Anything?
Nope.
Wonderful. Okay, now what I'm going to have you do is bring your arm out to the side and lower it in slowly. Good. And the other one. Excellent. Now I'm going to have you bring them one at a time out and just hold them. Good. And the other side. Excellent. I'm actually going to have you lay down on the table. I just want to check the stability of the joint, okay? What I'm going to do is just place my hand here. Any discomfort?
Nope.
Good. Joint seems very stable. Okay. And one more. Any discomfort?
Nope.
Excellent. And feel free to sit up. Wonderful. Okay, Mr. Meyer, so the next joint we're going to do is elbows, okay? So I'm going to have you stand for this. All right, and I'm going to have you start just kind of in a neutral position here. I'm going to have you go all the way down and up as far as you can. Wonderful. And then I'm going to have you come back to neutral. Put your hands flat for me. One at a time, I want you to just go in and out without moving your upper arm. Excellent. Any discomfort?
Nope.
Fantastic. So I'm going to have you do the same thing, okay, with some resistance. So I'm going to have you pull and straighten your arm out a little bit more and pull from here. Good. Okay. Now, push. Nope, flat hand for me. Roll your hand in, push against my hand, and opposite way. And we're going to do the same thing. Excellent. Wonderful. Now I am going to have you kind of straighten your arm nice out in front of you and flex your elbow. Any discomfort up in the elbow. Fantastic. And then do the same thing, but I'm going to push back on your wrist. So just extend your arm out. Okay. And relax the wrist for me. Any pain?
Nope.
All right, let's do this arm. Bend down. Any pain?
Nope.
Bring it down just a little. And any pain?
Nope.
Excellent. So I'm going to have you sit back on the table for me. Just going to take a look at your arms. So I'm going to have you one at a time. Just bend them up for me. Wonderful. Wonderful. Thank you. Next part is we're going to take a look at your hands, your wrists, your fingers. Okay, so I'm going to have you hold your hands up for me. Any pain?
Nope.
Any pain? Alright, so I'm just going to palpate the joints here. Wonderful. Any pain when I press on anything?
Nope.
Fantastic. Okay, so the first thing I'm going to have you do is just bend your wrists up and down. Try to keep your elbows in. Fantastic. I'm going to have you relax. And then move your wrist outward and inward. Any pain?
Nope.
Okay, and then the same. Wonderful. I'm going to have you hold your arms out nice and straight and roll your hand over and back. And again. Fantastic. Any pain with those?
No.
Good. So the next thing I'm going to have you do is reach your thumb across as far as you can. I'll have you do it on both sides. And then bring your thumb out like you're hitchhiking. Any trouble with turning? No. Fantastic. And can you move your thumb? Good. Have you put your hands down. Now I'm going to have you pull against my fingers. Wonderful. And do you have full movement? Fantastic. Okay. Now I'm going to have you do something called the balance test. So I'm going to have you bend your arms in and apply pressure. Any pain?
No.
Perfect. I'm going to have you bend your fingers back. Any pain?
Nope.
I'm going to have you apply pressure until you feel like one arm gives. Good. Now you must be right-handed.
Yes.
I can tell. The side that is weaker tends to give out earlier.
Oh.
And you can see it when you do that test.
Okay.
So excellent job. The last thing I'm going to have you do is hold this safety pin between each of your fingers. You should be able to hold it without problem. Excellent. Excellent. Any pain or discomfort?
No.
Fantastic. Next test we're going to do is to check your hips. So I'm going to have you start by standing upright, and I just want to make sure your hips are even. I am also going to check you from behind. Wonderful. Okay. Any pain in the hips at all?
Nope.
Good. So I'm going to have you lie back down on the table for me. We're going to do a couple tests here, okay? All right. So what we're going to start with is I'm going to have you raise your leg straight up, knee extended, and down. And the other one. Fantastic. Now I'm going to have you raise your leg up with your knee bent to 90 degrees. Any pain at all with those?
Nope.
Okay. Now before we move on to the next test, I'm going to have you do these with resistance. So pull your leg up. Good. And push your leg down. And then we're going to bring your knee up and push into me. Good. And push against. Excellent. We'll do the same thing on this side. Pull up and pull down and bend the knee. Pull and push. Excellent. Okay, so for the next test, I'm going to have you bring your knee up, bent. We're going to bring it out, and we're going to bring it across. Wonderful. Push against into my hand. Okay, and pull. Wonderful. And we'll do the same thing on this side. So bring your knee up and bring it out and across. Excellent. And same push and pull. Wonderful. Now with your leg out, I'm going to have you rotate your leg outward and in. Cross over if you can. We'll do the same thing here. Out and in. Cross over if you can. Now push against my hand and pull. Push against my hand and pull. Wonderful. If I can have you sit up and just sit on the edge of the table here. Nice and controlled. I'm going to have you bring your legs straight outward. Try not to lean back. Wonderful. Wonderful. Now I'm going to have you do the same thing. Push against me. Good. And push against me. Now with your legs outward. Pull down. Wonderful. Okay. So that's all we're going to do with your hips. They look to be fine. Did you have any pain or discomfort?
No.
If you're sitting, I'm going to start looking at your knees, okay? I'm just going to look at your knees and then we'll do the knee test. So I'm just going to have you relax. Wonderful. Excellent. Now can I have you again bring your knee outward for me and bring it back. Wonderful. And same on the other side. Beautiful. And I'm going to have you stand for me. We're going to do the same thing. I'm going to have you bring your knee up and bring your knee back. Okay. And I'm going to have you stand nice and tall, like you're bending your knees backwards. Excellent. Okay, for this next test, I'm going to have you lie flat on your stomach. Alright, I know as comfortable as you can be, right?
Yes.
I'm going to place my hand on your back here. I'm going to have you bend up. And hold your ankle and coming in. Any pain?
Nope.
Okay. We're going to do that again. Hold up in and out. Any pain?
Nope.
Excellent. I'm going to have you flip over for me. Okay. We're going to bring you just straight up a little. Okay. And I'm going to bring you out and in. Any pain?
Nope.
Okay. And then same on this one. I'm going to bring you over and back. Any pain?
Nope.
Wonderful. So I'm going to have you bring your knee up just a little for me. Okay, I'm going to spread your ankle. Good?
Yep.
We're going to turn you and turn you. Any issues?
Nope.
Wonderful. And one more time. Turn and turn. Any pain or discomfort?
Nope.
Fantastic. I'll have you sit back up for me. Okay, Miss Drummer, I'm going to have you slide back on the table for me. I'm going to have you bend your knees. Excellent. I'm just going to do some pushing. Any discomfort?
Nope.
Okay, over here. And anything?
Nope.
And anything here?
Nope.
Wonderful. I'm going to have you slide forward and lay flat for me. Okay, I'm going to have you bend your leg up to 90 degrees. I'm going to hold it under my arm here. Any discomfort?
Nope.
Excellent. And we'll do the same thing on this side. I'm going to hold your foot. Any discomfort?
Nope.
Wonderful. Okay, so we're going to bend your leg. Feel free to just rest it on my thigh. Any discomfort there?
Nope.
Okay, same on this side for me. Bend, rest. Anything there?
Nope.
Excellent. Okay, I'm going to have you sit back up. That's all we have for the knees. So the next is we're going to look at your ankles and feet. Okay? Okay, Ms. Drummeyer, I'm going to have you stand. I just want to watch you walk. I'm going to look at your feet while you're walking, okay? Just going to have you go back and forth. And I'll have you jump back up on the table for me. Just going to palpate your ankles here. Tell me if you have any pain. Wonderful. Okay, if I can have you slide back. All right, if you can push your toes down and pull back. And again. Excellent. And pull against my hand and push. Wonderful. Okay, and if I can have you just relax your foot for me. Any pain?
Nope.
Any pain?
Nope.
Fantastic. Now if I can ask you to close your eyes and you're going to tell me if you feel any movement.
Up, down, down, up,
Okay.
to the side, to the side.
Wonderful. Alright, I'm going to have you slide forward just a little bit more for me. Perfect. Now, does that hurt at all?
Nope.
Okay. Any pain there?
Nope.
Wonderful. Okay. Now if I can ask you to just lay on your stomach for me.
Okay.
And I'm going to have you bring your leg up at a 90-degree angle. Okay, and the other one for me. Excellent. All right, and if I can have you sit up for me, that would be great. Excellent job. The last test we have is we're going to take a look at your spine. Okay, so if I can have you stand.
Okay.
All right, I'm going to have you turn. Just going to feel me palpating down. I'm going to have you bend forward. Excellent. Well, next thing I want you to do is just bend over straight and just touch your toes and then go to one side and then the other side. Okay, I'll have you stand back up for me and then I'm going to have you kind of lean from side to side as far as you can. Any pain in any portion of your back while you're doing this?
Nope.
Fantastic. So I'm going to have you get up in the kind of the center of the table there for me.
Okay.
Okay. I'm going to have you lie on your right side first.
Okay.
And I'm going to have you bring your knee upward, like you're in the fetal position, so up, 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 and straight back. Any discomfort there?
No.
Okay, so I'm going to have you sit up and we'll lay on the other side. And bring yourself up like you're in fetal position, and back, and any pain there?
Nope.
Any pain within the hips at all while you're doing that? Fantastic. I'll have you sit up. That's it for range of motion. Okay, Mrs. Strohmeyer, we're going to test your reflexes now, okay? So I'm going to have you just straighten out your arm for me and relax nice at your side, okay? Excellent. And same on this side. Wonderful. And I'm going to have you just relax your arm. Okay. And relax your arm. Wonderful. Now I'm going to bring your arm out and just relax. Wonderful. Beautiful. Now we're going to do your knees and your ankles, okay? What I'm going to do is just palpate. Excellent. Any pain?
No.
Beautiful. I'm going to have you slide back for me on the table. Okay. I'm going to have you actually slide forward slightly. Thank you. And bring your foot upward. Wonderful. Good. Okay, now slide back just a little. Now you'll feel this sharp point, okay?
Okay.
I'm going to support you on the bottom. Good. Wonderful. Any pain or discomfort after that?
Nope.
Any numbness or tingling?
Nope.
Fantastic. Okay, so for the next one, I am going to have you stand again, and I'm going to have you walk, okay?
Okay.
All right. Excellent. Now for the next test, I'm just going to have you kind of come over here and just stand. I want you to stand with your feet together, nice and upright, okay? And for this one, you'll have your eyes open. All right, and now maintain that one with your eyes closed. Do you feel any dizziness?
No.
Fantastic. Okay, and feel free to open your eyes again. So for the next part, I'm going to have you sit on the edge of the table.
Okay.
And then on your thighs, I'm going to have you go like this, slapping your thighs, okay? It doesn't have to be real hard. And I'm going to have you do it with your eyes open and then your eyes closed. Excellent. Now for the next test, I'm going to have you bring your hands straight out, and with your eyes closed, I'm going to have you touching your fingertip to your nose. Okay, and then I'm going to have you lie down on the table. Now for this last one, I'm going to have you take your heel and run it from the knee to the ankle on the opposite shin. I'm going to have you do both sides twice, please. Excellent. Okay. Now for the final part of your examination, I'm going to do some sensory testing with you, okay? So I'm just going to have you stay seated on the table for now. Okay, so for the sensation test, how we're going to start is I'm going to have you close your eyes. I'm going to touch one of your extremities or your face with either a sharp, dull, or light touch, and you're going to tell me which touch you feel.
Okay.
Okay, all right, I'm going to have you close your eyes.
Dull. Sharp. Light. Light. Sharp. Dull. Light. Dull. Sharp. Light.
Excellent. Okay. Now for the next test, I'm going to have you put your palm up. We're going to do both hands. I'm going to write a number or a letter in your palm, and you're going to tell me what I write. Okay? All right, have you close your eyes.
8. C. Z.
Excellent. We're going to switch hands.
A. 9. D.
Excellent. Okay, so for the last test, what I'm going to do is I'm going to have you close your eyes. I'm going to place 2 objects in your hands, and you're going to tell me what objects you have, okay?
Okay.
All right. The first object.
Safety pin.
Okay, I'm going to take that back. And the second object.
A coin.
Excellent. And open your eyes. Great job. That is the end of your exam. Do you have any questions for me?
No.
Any concerns that have come up throughout the exam?
No.
Fantastic. Well, we'll be glad to see you again, hopefully soon. And if you have any concerns in the meantime, please feel free to call at any time.
Will do. Thank you.
Thank you.